Generally, the more white blood cells, the more that finding is specific for a urinary tract infection. You'd like to see at least 8 white blood cells per high power field. Somewhere less than 5 is very non-specific. The higher the number of white blood cells, the greater the confidence that this is in fact an infection. Okay. Now, if we see red blood cells, we can call that hematuria. White blood cells would be called pyuria. The presence of white blood cells in a urine specimen is referred to as pyuria. Red blood cells, hematuria. Sometimes there are enough red blood cells in a urine specimen that it tints the urine red. We call it gross hematuria. If the urine appears normal by gross inspection, but under the microscope we see red blood cells, we refer to that as microscopic hematuria. Now, in the face of an infection, you might see a lot of bacteria. Bacteria are much smaller than these cells. They tend to, it almost looks like they're vibrating. They tend to move. That would be referred to as bacteriuria. And many times it's quantitated as 1 plus, 2 plus, 3 plus, or 4 plus. If somebody has stones, what comes in with kidney stones, many times we're going to see on the microscopic exam is the presence of crystals. And in fact, if you ever go into a pathology lab, there'll be a big old poster in the micro area where they do the urinalysis, and that poster will demonstrate different types of crystals, what they look like. Because the crystals that come from uric acid stones, uric acid crystals, look different from calcium oxalate stones, another form of stones. Okay? And they look different from cysteine stones, which look different from struvite stones. And so the different types of stones that people tend to form are going to be associated with different shaped crystals. And of course would be called crystalluria, by the way. In addition to bacteria, sometimes you can see other stuff in urine. You might see yeast, or you might see trichomonas. Trichomonas. That's always an interesting looking organism. It's kind of big, and it's got this undulating flagella.
That's not a bacteria?
No, no. It's a protozoa.
Okay.
Trichomonas is a tricky thing because it can cause symptoms maybe similar to a cystitis, and you'll treat the patient, they'll get better, and then 2 weeks later they'll bounce back with the trichomonas infection all over again. What happened? They're ping pong. You have to treat the pong. Because usually the male will be asymptomatic. The female will be more symptomatic. So you treat the female, you clear her infection, and she goes home and has sex. Yeah. And then what happens? It bounces right back. And so all of a sudden she says, well, I didn't get better. She did, but it's ping pong. It's bouncing back and forth. So then you have to give the antibiotic. You have to say, give this to your husband, or to your SO, whoever. Okay. Maybe ping pong. Playing ping pong. What else can you see? Sometimes you'll have protein or cellular material that gets lodged within the renal tubule and takes on the shape of the renal tubule before it's flushed down into the bladder. We call these casts, C-A-S-T-S. Now when you count casts, you count the number of casts per low power field, because these are big things. So there's lots of stuff I'm getting at that can appear in the urine that has a form and a shape that you can see under the microscope. At the same time, if you suspect infection, at the same time, you collect a urine specimen for your analysis, you're also going to perform a urine culture so that you can culture out any culprit bacteria and perform sensitivity testing. You should have done that in micro. The culture sensitivity, but that takes 2 or 3 days to grow out. That provides some definitive information, but it's not going to give you an immediate answer. Okay. All right. Let me say one more thing. Sometimes people form stones. Stones, when they're formed, they tend to pass down the ureter. Many times they can get lodged there. And these things are tiny, much tinier than you would think. Okay. These would be kidney stones. They can block the ureter. Okay? And so watch what happens if you block the ureter. The proximal portion of the ureter dilates. We call it hydroureter. In other words, it creates an obstruction. If that swelling, if that dilatation extends into the renal pelvis, and the renal pelvis dilates like this, then we call it hydronephrosis. The problem with these stones is instead of having smooth margins, they tend to be jagged. And so as they're pushed down the ureter, they scrape the ureter and cause hematuria. They're also very painful. So when you go to urinate, you create a wave of peristalsis that grips onto that jagged stone and intensifies the pain. So it's a colicky pain, meaning it comes in waves, typically triggered by efforts to urinate. Yes?
What was the top part again?
Hydronephrosis.
And that happens when what dilates?
When the renal pelvis, the proximal portion of the ureter, is involved. Everybody with me? So in this case, you would see crystals, crystalluria. Now, of course, if you have stones that are causing obstruction, what do you think is a secondary complication? Infection. In fact, there's a rule in pathophysiology or pathology that goes something like this. Anytime you have stagnant fluid anywhere in the body, it predisposes toward infection. In other words, it just takes one bacteria up here to begin to multiply, and that can cause an infection which spreads back to the kidney. You can get a secondary pyelonephritis. So stagnant fluid predisposes toward infection. Movement of fluid is protective. It flushes out bacteria. Now, of course, if you have an infection, then in addition to the hematuria, you would see bacteriuria, you would see pyuria. So whenever you perform a urinalysis in a patient who's got a kidney stone, you also submit that urine for culture to make sure there's no underlying infection. It's complicated. By the way, that colicky pain that you get, it's going to be in the flank region. You're also going to have flank tenderness, but that pain tends to radiate down toward the groin as the stone moves down the ureter.
When you say colicky, is it the same thing as like colic in a baby? Like, does that just mean like
Colicky means it comes in waves. Think of peristalsis.
Okay.
All right, so it grabs you, kind of eases up, and then grabs you again.
Okay.
Okay? So it comes in waves. It's not a steady ache. It comes and goes. And just like in a baby, colicky is caused by spasm or the GI tract. Peristaltic waves make it worse.
Okay.
You have smooth muscle that surrounds the ureter, and that muscle contracts in waves. So it can create a colicky type of pain. All right, this is kidney now. I drew this picture of a kidney last night, and like a lot of solid organs, the substance of the kidney, what's called the parenchyma, can be subdivided into an outer zone called the cortex and an inner zone called the medulla. Not the medulla oblongata. So just like a lot of other solid organs, we're going to subdivide the kidney into a cortex and a medulla. Furthermore, the medulla, okay, this is the cortex, this outer shell of tissue, kind of lighter staining in this image. Here's lighter. The darker staining tissue is the medulla, and notice that the medulla is subdivided into little pyramidal shaped structures. So we can call these structures either medullary for medulla, medullary pyramids, or renal pyramids. So the medulla of the kidney is segmented into these pyramids. And notice that the cortex invaginates down between pyramids. Right? These cortical regions that sit between pyramids are called renal columns. They're made up of cortex, not medulla. Within the cortex of the kidneys, in fact, within the cortex of each kidney, you have 1 million tiny structures called renal corpuscles. And it's within these renal corpuscles that our blood gets filtered. For instance, where excess fluid or electrolytes or waste products leave the bloodstream and become part of something called the filtrate of the kidney. That filtrate is formed within the cortex. And then the filtrate passes down a tubular structure within the medulla where it's further processed. When I say processed, I mean some of the substances that were filtered get removed and returned to the bloodstream. And then other substances that weren't filtered get added to the filtrate. Okay? So that filtrate becomes modified or processed in the medulla, and then that filtrate, what's left after the processing, empties into this little cup-like structure here that surrounds the tip of the pyramid. Okay? The tip of the pyramid, this little nipple-like protrusion, is called a renal papilla. Here's a renal papilla right here. That's the very end. Now, remember we said you have these tubular structures that carry filtrate. As it's being filtered, or sometimes after it's been filtered, to the papilla. And surrounding the papilla, you can have this little cup-like structure here. That's called a minor calyx. So, here's a minor calyx. Here's a minor calyx. You have a minor calyx surrounding the renal papilla of each pyramid. And what it's doing is collecting filtrate that's already been processed. Once that filtrate moves from the renal papilla into the minor calyx, we no longer call it filtrate. At this point, it's going to be called urine. Once the filtrate moves into the minor calyx, it's known as urine. Until it moves into the calyx, it's simply filtrate. Now, look what here happens here. 2, or sometimes 3 or 4 minor calyces will join together to form a major calyx. Here we see 1, 2, 3 major calyces. So 2 or more, usually somewhere between 2 to 4 minor calyces, and notice that plural is spelled differently, will join together to form a major calyx. And a typical kidney will have 1, 2, or 3 major calyces. The major calyces will then carry the urine to the renal pelvis, this dilated proximal portion of the ureter. That's the renal pelvis. It's sitting, remember, within the renal sinus, this potential space here. Okay? Whatever space isn't occupied by the pelvis or by blood vessels or by lymphatics or nerves, it's occupied by fat. We call that perinephric fat, which means around the kidney. Nephric. Perinephric fat. Okay? So then again, filtration occurs within the cortex. Processing tends to occur within the pyramid. Once that filtrate is processed, it enters into the minor calyx where it becomes known as urine. If you have a problem with the urine, then we say urine trouble. Okay, sorry. Now, let's look at blood flow to the kids. You should know already that blood flow to the kidneys is via the renal artery, and you have a pair of these. A right renal artery to the right kidney, a left renal artery to the left kidney. And these originate from the abdominal aorta. In fact, I know one of the dogs, and maybe more, the renal arteries with a second,